Um, so we're going to get started today, and I welcome all of you, and please feel free to ask any questions, or you can wait until the end and ask the questions. But this is pretty a lax environment, and we want you to be able to communicate with us. So putting the eye back into the Ohio ISP. So if you see right now, you just see one little dot, and that is to symbolize a person. And when you're looking at the person, we're following through, and the circle around the person is the planning process. And that's everything that's going to happen, throughout your plan. And then when you go and you look, this is the person, and the flower, it kind of looks like a flower, is all the team members that are part of your plan. But you are the center of that planning process, and you drive that plan. So I just thought that was a neat representation of how things are supposed to go, and how you are the most important person on that team. So one of the things that, like, Heidi and I have talked, Heidi's been on the Ohio ISP team longer than I have, and there was a lot of town hall feedback, and this is when it very first started with mentioning having a single plan, calling it the Ohio ISP. And there was a lot of hopes, and there was a lot of fears. And the hopes, that we heard were that there was one plan across Ohio, and that was person-centered, and the ability to share your story, easy to update, have better conversation, keeping, what's important to and for. And some of the fears were basically just that we wouldn't have a single plan, and that there would be so many different ways to, produce the plan. And that was a real fear. They didn't want it standardized where it just fit, one certain mold. And this is definitely the Ohio ISP. As you learn more, it's very person-centered, and it talks about so many different things, and it shares your story so well. And Heidi, I'm not, sure, from the beginning, is there anything else that you've heard, talking about the hopes and fears that maybe I didn't cover? Oops, sorry.
No, I think you did a good job, Leslie. It was most interesting, right? That some of the things that some people worried about were some of the things that other people were hopeful for. Like, they were worried, oh my gosh, if it's a standardized template, it's not going to be person-centered. And then somebody else thought, oh, it's going to be a standardized template that requires people to be person-centered, right? So that balance, and really just to me conveyed the message that the unknown, like, we don't know. Some of us are fearful, some of us are hopeful, but everything that is on the list here that Leslie talked about was definitely incorporated into the development.
Thanks, Heidi. So what is the Ohio ISP? And you can find this video on our Ohio ISP webpage. And it just basically tells the story.
Ohio ISP, Introduction for People with Developmental Disabilities. What is Ohio ISP? The Ohio Individual Service Plan, also called the Ohio ISP, is your plan, your ideas, your visions, the goals you have for your life, and your successes and achievements. Your plan helps you communicate the services and support you want and need. There are 88 counties and over 450 ICFs in the state of Ohio. And before the Ohio ISP, this meant there were over 500 ways that a plan could be completed. So if you move from one county or facility to the next, you would need to complete your plan all over again. With the Ohio ISP, it is now one plan that is used across the state. Your plan belongs to you, and it follows you wherever you want to go in the state of Ohio. How does creating your plan work? Well, it's about teamwork. Anyone you want can be on your team. Conversations will take place throughout the year with your team, discussing things that you may want or need others to know about you. The plan is there to support you. Self-advocacy. As a self-advocate, you know your rights, speak up for yourself, problem solve with your team, and find support. Getting services you want, instead of getting only what is offered, is so important. It's okay to ask for help. We all need help sometimes. Being a self-advocate will assist you in getting the support you need. What you should know about the Ohio ISP. The Ohio ISP is easy to use and understand. Your Ohio ISP can be accessed wherever you go and whenever you want. Your Ohio ISP can be shared with your team at any time. Videos, photos, and documents can be easily uploaded to your profile to share with your support team. By using the chatter feature, the Ohio ISP supports better communication for your entire team. You should know there are two parts to the Ohio ISP, the assessment and the plan. The assessment. Through questions and conversation, you and your team will let others know what services are important to and important for you. The assessment truly drives your plan. The plan. The Ohio ISP places what is important to you and for you in the center of the planning. You will lead the planning process by making choices, setting goals, and deciding how you want to live your life. You can do this by talking to your team, thinking about what is important to you and for you, learning new things, and being creative on how you can get to the life you want. The planning process also helps get to how you need supported, services that can help, and how technology can be used to increase your independence. If you have questions, please reach out to Ohio ISP at dodd.ohio.gov.
And so, that little video basically tells you about what the Ohio ISP is and what it's about. And Abby is going to share, some information on how you can create a Gmail account. Everybody that has wants, to use the technology part of the Ohio ISP would need an email account, and you don't have to use the Gmail account if you already have an email account. And Abby will explain that a little bit further. And then you may not, decide that you don't want to see stuff electronic, and in that case, it can be printed off, and you can view it that way. But Abby, would you like to explain how to set this up?
Yeah, so the process is pretty simple. So for anyone who wants to access Ohio ISP, you need what is called an OHID. To create an OHID through our system, you need to have some sort of personal email account. So not a work email, but a personal email account. And so the easiest way to do that is through Gmail. It's free. It's a fairly simple process. And so we have a video here that just very briefly shows you how to do that.
If you'd like to access DODD applications, you'll need to provide an email address, but if you don't have one, no problem. You can create a brand new Gmail address in just a few easy steps. First, open up a browser window on your computer and go to gmail.com. When the page loads, click the Create an Account button. It's located in the upper right corner. To create your Google account, enter your first name, last name, username. Now it can be anything you'd like it to be using letters, numbers, and periods. It just needs to be unique. But don't worry, Google will let you know if it's not. Enter a password using 8 or more characters with a mix of letters, numbers, and symbols. And confirm your password by typing it again. Now don't forget to write down the username you chose and remember that password. Finally, click Next. To make sure your information is private and safe, enter your phone number and a recovery email address if you have one. Enter your birthday and finally, your gender. Click Next. Finally, read Google's privacy and terms statement. Scroll to the bottom and click I agree. That's it. You've created a Gmail account, and at this point, your email inbox will automatically open. Good job.
So to break that process down a little more simply, you basically just you pick what username you want to use. You put your name in there, and then you put backup information, your phone number, a secondary email if you have it, and your birthday, and that's it. So and then you have access to that, and it's free. And then that's the email address you will use to create an OHID. And now we can, on the next slide, we'll talk about, yeah. So if you want to view your plan digitally, like Leslie was saying, you need to contact your case manager. That's your SSA or your QIDP. They will send you an invitation email. And so you will receive an email that will have some links in it. And the primary link in there will take you to get in with, to create an OHID and to get into the system. Of course, at any time, if you have questions or problems, you can always reach out to us and we can help you with that. Also, your SSA or Q should also have a fairly good idea of how to help you as well. And if not, again, you can always reach out to us. And I think the next email, it's been a long day. The next video actually talks about this process and what it looks like.
If you have access to the Ohio ISP system, you'll be able to log in and review your current and past plans. And if your case manager is using the Ohio ISP system, you can also sign plans digitally from your computer or smartphone and chat with the team online. So now you're probably wondering, how can I get access? Ask your case manager, that is the SSA or QIDP, to send you an invitation, and once invited, you'll receive an email. The email will provide you with a temporary PIN. Make note of that, and then click the link. Enter the temporary PIN, create a new password, and click Continue. Success! Your password has been created. Now it's time to check your email again. You'll receive an email letting you know your account is ready. It will also give you your new login name. Click the provided link and log in. Enter your login name and password, then click Sign In. On the DODD Applications page, click the Applications link at the top of your screen. Click the Ohio ISP tile, select the button that says I'm a provider, individual, family member, guardian delegator, or QIDP, and finally, click ODX. Congratulations, you now have access to all your plans in the Ohio ISP system.
So one of the things that we worked on was to make kind of the view for individuals, guardians, and family members very kind of simple and easy to navigate. It's also very easy to navigate from your smartphone. So if you have a smartphone, you're also welcome to use that. Those tiles that we saw are really easy to tap on your screen. And so that's another great way that you can access it. So if you don't have a computer, don't worry, you can still get access to your plan.
And I think that, Abby, right there is really important because a lot of us use our cell phones for everything, whether it's GPS or a calendar. So I think that is very important that everybody knows that you can use any type of mobile device to see access the Ohio ISP and their plan. And it's nice because sometimes individuals would like to share their plan or talk about their plan to other people, and they have easy access just by pushing, the application button. So I thought that was a very nice feature. So when we're looking forward, and this is kind of what this is what the SSA or the QIDP will be looking at. And if you're sitting on the computer with them, this is kind of what the screen will look like. This is not what it's going to look like to you when you get your plan, but this is actually the questions and the categories where that are in the assessment, and there's 7 categories, and it's just really meant, these categories like communication, to have those conversations and to kind of spark some interest and to talk about the things that you like, what you might not like, how you best communicate. And again, this is just a part of what they will see and some examples of the types of questions. And then when you look at this and it says, what should I expect during the discovery assessment? And last week I was able to have the opportunity to kind of go over the Ohio ISP with a lot of individuals and families and SSAs and just a wide group of people. And, one of the questions that came out is like, what should I expect during the discovery assessment? Should I expect that I'm going to be sitting in a room for hours and somebody's going to be asking me 100 different questions, and am I going to have to answer all of them all during that time? And the answer is no. The discovery assessment is meant for ongoing conversation throughout the year. You're going to learn and explore together. You're going to have different conversations. And when we talk about having conversations, it's conversations whether your SSA or QIDP meet you at a park, they come to your home, wherever you feel comfortable and secure with. And I share the story about, walking into a room full of people that you don't know and trying to explain, your story. It's very intimidating. And, that's what this is not meant to be. It's not meant to be intimidating. It's meant to assist you and to give you your life that you want. And it should, the conversation should be comfortable, in a comfortable environment, and be able to, share your story anywhere you want. And then, with the communication, we talked a little bit, that is one of the sections of a single plan, the assessment. And, I'm going to share another story that I received. I was working with an SSA, and SSA came back to me and said, mom said that, she was helping me, learn about her daughter, and the daughter is not able to answer these questions, and mom doesn't know how to answer them either. And the questions are, You know, how does the person communicate? You know, what best, you know, how do they express themselves? And so I challenged the SSA to go back with mom and sit down because although the, her daughter could not communicate in words, she was very communicative through her expressions and how she communicated in her body language. And sure enough, when the SSA came back and said, "Hey, there was a lot of communication I just learned about," and you know, when her daughter would be not feeling well or upset, she would have a very grimace face and she would squint, and that would indicate that she was not feeling well. And when she would have a high pitched scream, it usually meant that she was happy and she wanted to listen to music. And so from from no questions being answered to a full page of things that mom knew because mom knew her best, um, she just didn't think to share those things. And so, you know, that's what I encourage everybody, you know, to sit down and dig deeper and talk about those different things. And so when we look at this, and this kind of it also has a communication chart, and you know, Heidi knows this about me, and probably some other people on the call know this about me. So it's important to me and for me to have my coffee in the morning. I am not a morning person. I need quiet for about a half hour, and I need to sip on my coffee. And so if I do not have that, that means I'm going to have a bad day. And it's not on purpose, but that just kind of happens that way. And so the known and likely risk section talks about, you know, things that might be a safety concern. And you can see some example plans on the Ohio ISP webpage. And I encourage all of you, if you hadn't have a chance to go on the Ohio ISP webpage, there are a lot of resources on there to find, and we're constantly building. And if there's something that you don't see that you need to see, or you think others can benefit from, please reach out to us in the Ohio ISP email, because you know, we're always looking at improving our support, and we want you to be able to use the things that we put on there. And so again, you know, with every section of the assessment, you know, there are things that are working, what's not working, if you know, you need support, if you don't need support, and if there's technology. We talked about technology last week at my last webinar about like how many things that you use for technology on a day-to-day basis. And there's a lot of good answers. You know, they were talking about, you know, using Alexa to remind them to take their medications, and ring doorbell when you know, they're staying at home and you know, not sure who's coming to the door. So there's so many different things out there that people use that we just really don't think of, but we use every day. And then this actually here is kind of what you're going to see when you get a printout of your plan. And it's just going to be very, you know, clean and to the point. We've really tried to express, you know, to SSAs and Qs, you know, use simple language, and so everybody can understand. And sometimes, you know, it gets confusing when we start using terminology that we shouldn't be using. So, Heidi, did you want to add anything?
Maybe just right. So the first section Leslie talked about was communication. This one is social and spirituality. That summary section that she looked at, there is a summary at the end of all 7 assessment sections. so that when your SSA or QIDP is learning information about you, the things that are the very most important make it to that summary section, right? And that then carries over to your plan.
Okay, thank you, Heidi. And so here are the 7 sections that really get talked about. You know, it's communication, citizenship and advocacy, social and spirituality, daily life and employment, community living, healthy living, and safety and security. And we really took all this, and some of this might look familiar to some of you because it really aligns with the Charting of the Life course terminology, and that's kind of where we got it from and we're able to use. And when we talk about like the community living and the daily life, you know, we're not just looking at what happens at home. We're looking at your entire life, what you do, and just not focusing on that small part of maybe you only receive day services. It's important for us, for your story to be shared and to be talked about. And so this is just an example, and you can find it on our website, but this is Arthur Fonzarelli. And Arthur's plan is, you know, just basically what your plan should be looked at. However, it will have your picture on the front, and it will have your information all about you and what, you know, what we should know about you to support you. And then as we look at, this is what we call the introduction page. And the introduction page is an introduction about you. And we really encourage individuals to join in and talk about what's important to you, what's not important to you, what's important for you, how best we can support you. And one of the ladies last week said, you know, hey, I just adopted my first cat. Would you like to see her? And I said, oh, absolutely. So she showed it to me, and it was something that was very important. She goes, so if I took a picture of my new cat, I could put that on my plan. I could put that on my introduction plan page and show it. I said, absolutely. Absolutely, you could do that. And then there was another young lady who had a very special pet. It was this pet therapy dog. And she's had him or had her for a year, and she said, you know, she's part of me, you know, she's part of who I am, and she needs me as just as much as I need her. And can I have a picture of us both together, and then can I tell about how she supports me? And I said, yes, you can. And that's exactly what she, you know, she plans on doing, is going to say to others like, hey, you know, I'm important, but so is my therapy dog, and this is how she helps me overcome some things. So I thought that was very interesting that, you know, she pointed that out. And you can, along with adding, you know, pictures, you can change font size, you can put graphics in it. It's anything that you think that would be interesting to introduce yourself. And so I'm going to move forward to this next. And one of the things that we did discuss last week was individuals were very concerned how their information was getting shared, and making sure that only the people that they wanted had that information. So I'm going to share this little video on, you know, your privacy and who can access this.
I'm Caitlin, and I live in Chillicothe.
Hi, I'm Beth Chambers. I work for the Ohio Department of Developmental Disabilities. I'm the statewide Ohio ISP manager.
Hello, I'm Ed Carr, and I have the privilege of being DODD's Chief Information Officer, which means I lead the information technology team here at DODD.
What kinds of information does the ODD have about me?
That's a great question, Caitlin. Some of the information that we might have at DODD is your name, obviously, first and last, your date of birth, address, maybe your Medicaid number, Social Security number, and history information and family information are some of the pieces of information that we have here at DODD.
Why do they need this information?
Another good question. That information is used to help you get the things that you want and need. And the information is used to get benefits, health records, and to help coordinate services. The information makes sure that team members can get information using history, that they can make sure that they have the information for you and not someone else. There might be someone else with your same first and last name, and they want to use that additional information, your date of birth, your Medicaid number, to make sure that they've got the right Caitlin, so that it's not someone else's information. So that would be a good example where if they're looking up your record, they could go a little bit further and use something else in addition to your name.
How does the ODD keep my information private?
Hi, Caitlin. That's a rather involved question. There are several layers of security that we use at the state, and those layers align nicely with the federal standards for information security. At DODD, we have additional layers of security to protect your sensitive information, including all of our information is accessed through the state secure enterprise network. All the devices that are used on that network have to be authenticated or known to the network in order to work. We also have users use a process called multi-factor authentication. It's a big fancy word, or MFA, which means you have to prove you are who the system thinks you are in order for you to get in and use or access the system. So it's a very good security technique that we recently implemented. We also have data encryption to make sure that if data is accessed by the wrong person, they won't be able to read it. And we use various other technologies that are very numerous for us to, too numerous for me to list right now, but we do take securing your information very seriously.
Yeah, Caitlin, I just wanted to add that, as Ed mentioned, there are many layers of security. We have to have passwords that meet a certain criteria. We have to have a certain number of characters and letters and numbers. And when Ed said there's a multi-factored verification, that means once I log in using my password, then the system makes sure it's me by saying, we need to verify this, and it calls me on my phone, and then I have to enter another security code. So there's kind of a few steps that make sure that we have the right access before we get into any personal information.
That's right, Beth, and a little bit more information there. State employees that are permitted access to the system are required to take regular training. Most of that training is annual training to help ensure that people, bad actors, you might have heard the term phishing. That's people trying to get into your system by stealing your credentials or your user ID and password so they can log in as you. So we go through annual training to help us make sure that we know what risk signs to look for to help prevent those types of things from occurring.
Great information, Ed. And sometimes they try to trick us, Caitlin. They send an email to see if we'll respond, and then they know whether we paid attention during the training. And we do take training. We have a lot of trainings that we have to take. We have to make sure that everyone follows the same process.
Who will have access to my information?
Another good question, and specific to the Ohio ISP or individual service plan, any user wanting to access an individual's plan must obtain first what's called an Ohio ID or OHID for short. In this process, they have to prove again who they are in order to be granted that account, and then in addition, they would have to be expressly identified or listed as part of your team on your plan to have access to your information. In addition to users accessing the ISP that way, there's authorized users here at DODD, at county boards, ICFs, developmental center staff that may also have access to your information as part of doing their day-to-day job.
And I think it's important to remember there that I can only access your information if I have a reason to do so for my job. So that's part of the training that we talked about, is that we can't just go in out of curiosity and look up people's information. There has to be a reason, and it has to be directly tied to our job duties.
What if I don't want someone on my team to have access to my information?
Well, you are in control of that through the individual service plan process. So any individual that's a team member has to be identified on the individual service plan. And at any time, you can update that plan to add or remove an individual. So that's really a part of that planning process.
Really good point, Ed. It's important for people to know that they can work with their SSA or QIDP, who helps write their plan, to worry about who's part of the team, who can have access to their information. So you can certainly control who gets that information.
Who do I contact if I am concerned about keeping my information private?
That's a really good question, Caitlin. It's always important to start with your SSA or Q, who's helping you get your plan together. And you can talk to them, your SSA or QIDP. You can talk to your guardian if there's a guardian involved, family member, someone you trust, just to let them know that you're concerned, and they can help you figure out what to do about that. Thank you, Caitlin and Ed, for talking about this very important topic today. I know that lots of us are worried about our information being kept private. And Caitlin, we hear from lots of people that they really want to make sure that we're only looking at their information as much as we need to and keeping their information as safe as possible. So we really appreciate your time today. Thanks, everyone.
And that was a great video, and it really did explain about how, getting access is not, as easy as we're trying to make it sound. It is difficult because we want to make sure that your information is safe, but also letting you know that it should be easy to be able to pull up once you have that access. I have like one more video I would like to share, but I'd like to take the time if you have any questions so far. I know that there was a lot of information that was given to you or we talked about, and I just want to give you a few minutes if you have any questions, concerns, to speak up, and there's no question that I probably haven't heard yet, so please feel free to unmute and ask your question.
Hey, Les.
Yes.
Joy put a question in the chat earlier.
Okay.
She wanted to know, I need to go back and find it. Okay. She wanted to know how the ODDP intersects with the new Ohio ISP. So The DDP, Joy, I'm guessing that you're aware, the DDP is used specifically to give somebody a funding level on the IO waiver. There's also a version of the DDP that is utilized for funding in ICFs. So in both counts, the DDP is related specifically to funding. And it's kind of a, you know, it's an assessment that puts somebody in a range. Does that mean that every single person who has a DDP, their services always live within that range? No, right? There's a process for when your services cost more than the range that you fit in. And also, if somebody's services are less than what their funding range, than what it's expected they would be, a county board has to notify them. So the DDP asks a number of questions really just to determine funding. There are a couple of specific questions from the DDP that were carried over word for word to the Ohio ISP assessment. They are both specific about some behavioral supports that a person might need. So there's that happens, but there are also some minor differences, right? When the DDP talks about the assistance that somebody needs with medication, it's worded just a little bit differently than the language in the self-medication assessment, which is an attachment to the Ohio ISP assessment. So they kind of go along. There should definitely not be any major differences with responses to the DDP and responses in the Ohio ISP. One should support the other, but just remembering that, you know, one is specifically to determine a funding range. It's taken a high level look at some needs that a person may have, what their living situation is like. And the other one, that was the DDP. The other one, the Ohio ISP, is really to determine the type of supports that a person might need to be supported with by a paid provider, by natural supports, much more all-encompassing assessment. So if you have any other questions about that, or anybody else has questions,
Thanks, Mandy.
feel free to unmute.
Oh, looks like something else came through. I'm sorry, Heidi.
Yeah, no problem. Joanne Rosie asked why we need both the DDP and the greatly expanded ISP assessment. So first, at least for families, having overlapping assessments seems confusing. So in some counties, the Ohio ISP assessment is expanded. In some places it is not. So, so when we say that it's greatly expanded, that is not the case all across the state, right? There were 88 different counties who did it 88 different ways, assessing somebody's needs. And there are also, you know, over 450 ICFs, intermediate care facilities, that also have their own process. So getting to one, you know, involved a work group of people from all across the state, all different walks of life. And that was where we ended up with what we have today in the Ohio ISP assessment. The DDP has been around for quite a while, and it actually has some formulas built into it to determine funding. It is the hope, you see my fingers are crossed, it is the hope that one day when we have an assessment center, which is a huge undertaking of our IT department, that the DDP will be able to be merged into the Ohio ISP. We're just not there yet. You know, we wanted to start as simple as could be, and then work to there being one down the road, right? It's not even just the DDP. There may be some other assessments that you're not aware of. The AAI, which gives somebody a funding level for day services. There's the hopes that that will happen also. You know, everybody has a level of care. Hopefully one day everything will be combined, but it was just too massive of an undertaking for that to be part of the initial rollout.
Someday, right? Someday.
Yes, and I just wanted to add to that. We do have a project where we are working to combine those. So we can get them into Salesforce and see what we can do to eliminate some of that duplication of questions. So that's coming.
Absolutely. And when that day comes, we will be thrilled to death. I'm sure everybody in the field will too. Yes, Abby?
Yeah, I wanted to add as well that, we have all these different areas, sort of life areas that are in the discovery assessment, for example. If this section doesn't apply to you, you don't have to fill it out. So it is expanded, but it gives you more options, but you can also scale it down to what applies just to you. And that's sort of the person-centered part of that you don't have to fill out every single question. And there are a lot of fields in there will actually appear only if you put certain answers in. So if you don't answer a question a certain way, you don't even have to answer the questions that are connected to that. So that's another thing too. It is expanded, but it's not actually that big, not for you, for your case.
And Abby, that's a good point. And I think Heidi, that's also you had mentioned about like over 500 ways to do a plan. And sometimes when an individual went from one county to another county, that plan was so much different, and that assessment was so much different. And so you as an individual would have to start that process all over again. You would have to tell your story from top to bottom all over again, where now you have to tell it once, and you just keep adding to that story, and you keep adding that information. And I think no matter where you go in the state of Ohio, that plan follows you. And I just think that we're just heading in the right direction. It's going to be easier for individuals that I don't like to share my story more than one time, so I can imagine that that would be hard on some people. Any other questions? Okay, so I had the opportunity, along with some of my coworkers, to meet and to work with some SSAs and QIDPs and some administrators, and meeting individuals and some direct service staff that really have come to me and talked to me about, like, hey, this is what we think about the Ohio ISP. And so I asked them to share their experiences. So I'm going to show you this very last video, and I hope that it brings joy to you as it brought joy to me with their excitement and their enthusiasm. And then after you watch it, I will share one little short story about the person that's going to tell a story in here. Okay, so we're going to play it now.
I'm Regina Duff, and I'm a Service and Support Coordinator for the Washington County Board of Developmental Disabilities.
I'm Karen Thompson.
Hi, I'm Heather Ray, and I'm with RHTD, and I'm out of Washington County. I've been providing services with Karen for at least 20 years, our agency.
My name is Renee Fott, and I'm a Service and Support Administrator with the Montgomery County Board of Developmental Disabilities. I've been working with the board since September of 2008.
My name is Hester Brown, and I'm the Associate Director of Community Inclusion for United Cerebral Palsy of Greater Cleveland. I've been with the agency for 7.5 years and worked in the field for 21.
Hi, I'm Jamie Huck, Service and Support Administrator from Washington County.
I read Karen's previous ISP and I knew that having a cell phone was important to her, but it didn't really capture why having a cell phone was important to her. But going through the assessment and just kind of having that conversation with the Ohio ISP, what I learned was that Karen is on the go all the time.
Just trying to come up with a good concept on how we can utilize the basic plan for Karen. You know, and I was very impressed with Regina and the way she would reach out and she was just trying to mainly learn Karen and kind of get to know Karen before she sat down and actually put everything down in paper. So I was very happy to communicate back and forth with Regina. You know, I felt like we were more of a team for Karen, that we could kind of come up with ideas and Karen could tell us kind of what she wanted to do. And then we could just push forward from there.
It takes time.
The Ohio ISP looks more into their hopes and dreams and how we're going to help them achieve those. So I think that those questions really open up a lot of doorways.
Since the development of the Ohio ISP, it's really revamped the way we think of developing an individual service plan.
A better learning tool in general to learn more about my folks than maybe our previous plans and assessments. I think there's a lot more, a lot more personal, like, information, if that makes sense. Like, really, like, how do they feel about this? What do they like about this? What do they not like? Where I think maybe historically it was like, we don't like this, we're not going to do this, and it was done. Where this is more, it digs a little deeper maybe. So that has been interesting to see, and hopefully that will help us better serve folks moving forward, because we'll have a better idea on what they really want, what my real dreams are and what my real wishes are, as opposed to us just kind of guessing as a team sometimes. So I think that is something that our county looks forward to, learning more about our folks and being more involved in that way. I like the assessment giving actual questions within the questions, right? So it has this general question, but then it has in parentheses, this is what we're looking for in this section. And I feel like those are a little more conversational in nature. So those are helpful.
As an SSA, I feel like the most important part of the job is communication with the individual and communication amongst the team members. And I really appreciate in the Ohio ISP that the first section I see when I start a plan is the communication section. And as I go into the Ohio ISP, every time that section is still the first section I see. So I'm always adding to that communication section, even when I've progressed to other sections, because to me, communication is so important. It establishes that rapport and it builds the trust.
I will say that the Ohio ISP has helped me to focus more on the use of technology for my individuals, maybe looking at that in a little different way.
I am really excited to get my entire caseload flipped over to this Ohio ISP.
So to kind of let you know, Karen, I'm so excited. Her outcome was that she would have her own phone and to be able to use it, effectively and efficiently, and to provide herself with some security. And Karen has her own phone. She carries it with her in the community. And she is so excited about being able to contact people if she needs them to feel safe when she's traveling, because she is on the go all the time. She loves to shop. She loves to go visit people, and that added security just makes her very successful. So I'm so glad that they had the opportunity to have those conversations and go through that assessment to come out with that outcome. And so as we close today, I just want to let all of you know that if you have any questions, you can contact us at OhioISP@dodd.ohio.gov. Or you can reach out to me, Leslie Powell, Regional Support Facilitator, or Heidi Davison. And we'll be happy to try to answer your questions. But before we end, is there any other questions? Okay. Well, that concludes our webinar today. I thank you very much for attending and spending your afternoon with me for an hour. And I look forward to hearing some more success stories. Thank you, everyone.
Thank you, Leslie.